Hi, I'm Brian Burnikel. I'm the Medical Director for the Center of Joint Replacement here at Steadman Hawkins Clinic of the Carolinas. Today I want to talk to you about the rehab program that we're utilizing for total knee arthroplasty patients. We incorporate a prehab program which includes strengthening exercises, neuromuscular stimulation for our patients. Post-operatively, again, we include neuromuscular stimulation as well as the standard rehab programs. Studies have shown that patients may have up to 50% deficit in their quadricep strength after total knee arthroplasty, and some patients really never improve on that deficit. Well, why is that important? Well, the quadriceps are really essential in stair climbing, squatting, speed of gait, and many of the activities that we do through normal daily activities. One of the things that we include in our prehab and post-op rehab program is neuromuscular stimulation. We use the Kneehab device by Neurotech. We use this device because it has some unique features. You essentially apply it like a garment, so it makes it easy for the patients to apply it, and it makes it easy for the patients to utilize it. The other thing that's unique about the Kneehab device is the sequential stimulation of the quadricep muscles is very similar to what happens in our natural neuromuscular system. Right now I'd like to have one of our therapists go through the program with you.
This exercise is heel slides. It's a good exercise for knee flexion after surgery. And so what we're going to have him do is just nice and gently slide his heel up the table until he feels a stretch. Hold it there for just a minute. Sometimes you can let your patient just relax and see if they can get a little bit more. And then we're going to let them come back down nice and easy. Good. And they can kind of repeat that. If in the clinic, sometimes it's helpful to do soft tissue mobilization and some release here at the incision or in their quad or other muscles to see if you can get additional motion. And then we'll let it come back down. For some patients that get a little hamstring irritation in the back, I like for them to use most of their upper extremities to do the work. So you just give the patients the strap. They're going to slide up using their arm strength. And then that way they can kind of maintain that knee flexion a little bit better without having to use their hamstring in the back. And then they're going to come, let it relax, take it easy. This exercise is chair slides, and it's important for getting knee flexion after surgery. It tends to be a very comfortable way for patients to feel like they can bend their knee. And so there's a furniture slider underneath of her foot. You can use socks on hardwood floors or any other thing that kind of helps the leg glide nice and smoothly. And she's going to just pull her heel back underneath, kind of hold it there at the very end, and then let it slowly come back out nice and easy. Good. And it's really up to the patient how much they can tolerate. I normally tell them to take it to the point where they feel a good stretch that's tolerable but isn't miserable. Hold it there for a little while, and then if they can, pull it back just a bit more and then let it straighten back out. Some patients who maybe have a little bit of hamstring irritation with this will benefit from having a strap that goes around their foot. That's perfect. And then you just take their hands and then they'll use their arm strength instead of their hamstring to kind of give their knee a little bit of bend. It gives them a little more control through their foot. They can hold it and then let it relax. This exercise is wall slides, and it's very important for knee flexion after surgery. This can be a very comfortable way for many patients to feel like they can get some flexion through their knee. So they're going to start just with their foot up on the top of the wall. We're going to gently let their knee bend. And they're going to take it until they feel that stretch either around the incision or into their knee. We're going to let them hold it just for a little bit. Let gravity kind of do the work of the stretch here. And then we're going to take the leg and extend it back up just to give it a break. I find this position's a lot more comfortable for patients to tolerate if they're getting any kind of hamstring irritation with heel slides or any other type of knee flexion. That looks great. Okay, this exercise is called propped knee extension. And so what I'm going to have you do actually first is lay down, get comfortable. Excellent. And this position is better for the hamstring to be relaxed. And we're just going to take a bolster and lift that leg up and let your ankle just sit and kind of make your knee feel heavy as you're sitting here. And you should feel a little bit of a stretch into the back of your leg, hopefully. And exercise is easy. We're just going to let gravity do all that work, and you're just going to stay nice and relaxed. That looks good. This exercise is prone knee hangs for knee extension. And so what I'm gonna have him do is just scoot down the table here. He's gonna come all the way to about where his kneecaps are, right at the edge. Some patients are more comfortable with their patella off, some patients like it to be on. It's all about that patient comfort at that time. And so we're gonna let gravity kind of pull on the back of his leg, stretch this knee out just a little bit more. And some patients don't feel much of a stretch here depending on the level of contracture they have at their leg, or depending on, in general, how tight their hamstrings are. And so sometimes we add a little extra weight onto the end of his leg. And I add anywhere between probably 2 and 5 pounds. I don't typically go more than that, but it's whatever the patient can tolerate. And we let gravity just do its thing here and kind of just wait 1 to 2 minutes, or as long as the patient can tolerate. They can do this exercise at home, hanging off of a couch or off of the end of their bed also. It's a very effective way to get the end range of their knee extension with a little bit more comfort. This next series of exercises is balance exercises, and they're very important after surgery to help promote joint proprioception afterwards. And so what I'm gonna have him do, I like to have patients start off with a pretty easy version of this exercise with his feet being together. So we're gonna put heels and toes together. This is probably the easiest way to start off with balance exercises. Further progressions include him taking a slight step forward with his right foot into half tandem, and then into full tandem with his heel towards his toe. And then when a patient progresses further beyond that, I have them lift their leg up into the air so that they're standing on one. And I always like the surgical leg to be behind. It tends to be a little harder that way. And then kind of once we get them comfortable with being able to stand in those different positions, I have them add on additional pieces to help with their vestibular system and to help with their vision system after surgery. And so I'll have patients pick whichever position seems to be the most difficult for them, but that they can still maintain for about 30 seconds. I'll have them stand with their eyes open like this. Then I'll have them look up towards the ceiling and down towards the floor, using their full neck range of motion to engage their entire vestibular system. And I have them do that a couple times, and then I'll have them look to the right and look to the left. And I'll have them do that about 10 times also. And it's normal for patients to feel more wobbly or unsteady doing all of this, and that's good. We need that system to respond to all of that. And then I'll have them keep their head straight and then close their eyes to really train their proprioceptive system to be able to handle the times when their vision might be compromised. This is a seated hamstring stretch, and so I'm gonna have her just take her left leg out straight. Good. We're gonna keep her right knee bent so that we don't end up with any pelvic rotation that happens as she's sitting. And I always ask my patients to sit up as tall as they can. I like them to think about bringing their sternum down towards still keeping their sternum ahead, but leaning down towards the floor until they feel that stretch in their hamstring. They're just gonna hold it there for a little bit, and then nice and easy come back up. Looks great. This exercise is a hamstring stretch, and so we're gonna take a strap or something similar and put it just around her left foot here. Good. I'm gonna hand that strap to you. And we're gonna keep the knee nice and straight, and all of her arms are gonna do the work to lift her leg up into the air, just nice and slowly until she feels a stretch in the back of her leg. We're gonna hold that for a little while. So most stretches we like to hold for maybe 30 seconds if a patient can tolerate it. It can be a little bit less if we need to. And then they get to relax. Take it easy. Good. And then you can give your hands a break too. Excellent. This stretch is a prone quadricep stretch, and so we're gonna use it at the middle to the end of their rehab when we're trying to get more knee flexion. And so I like to take this strap, put it around the toe, and we're gonna hand him the strap up at the front so he has full control of the stretch. He's gonna pull back until he feels a stretch in the front of the thigh, kind of hold it there for just a moment, and then let it relax, go back to being a little more straight, Patients can go all the way back down to the table. Sometimes they like to stay in that little end range and really work on gaining some additional flexion that might have been limited by quadriceps flexibility at the end of this. That's good. So this is a calf stretch in supine. So we're gonna take a strap, put it around the back of her foot, preferably kind of right around the ball of her foot. And then you're gonna just take your hands, pull back until you feel a stretch in your calf. And so I make sure most of the time it's important that the patient doesn't allow their knee to bend or sneak up this way. They're not gonna get a great stretch in their calf then, they're just gonna get one in their soleus, which is okay, but for this exercise, we really want them to feel it in the back of their knee. So you're just gonna pull, and just like any stretch, hold for about 30 seconds. This one's usually pretty tolerable by most patients and feels pretty good, especially after they've been bending their knee or straightening it for a while, just to give them a little bit of relaxation in the back of their leg. This exercise is a standing calf stretch, and there are variations of these exercises using a slant board or using a wall, but if you don't have any of those available, a patient can just take a step forward with their right foot, keeping their surgical leg behind them. And then he's just gonna lean his body weight forward, keeping his heel down on the left side until he feels that pull in the back of his calf. This exercise is weight shifting, and it's pretty important early on after surgery to get a patient more comfortable with accepting weight through their new knee. And so what I'm gonna have him do is just keep his feet shoulder width apart. He's gonna shift all of his weight over to the left leg, and then he's gonna come back towards the right to kind of give it a break for a moment. And you can have patients just do whatever they're comfortable doing. Back over to the left and then to the right. And then a progression or further step from this is to have the patient actually practice taking a step forward with their left leg. Good, I like them to hit their heel down just like that, lean their body weight into it, and then step all the way backwards. And just get comfortable with that initial phase of gait where they're loading their leg, fully accepting the weight through their new knee. So I'm gonna kind of walk through what happens when you get a Kneehab for a patient and the whole process of setting it up and explaining to them how it'll feel and kind of how they can be able to use it either in the clinic or at home. And so the Kneehab comes in two separate boxes because there's a specific right garment and left garment, and there'll be an R or an L up at the top depending on which one we have. And then the separate box on the bottom is for the controller, and we'll use that one in a second. But the Kneehab is really fit based on each individual's quad length. And so here we kind of, you can see that the top part is, this is a large Kneehab, and then it goes all the way to the superior part of the patella is how it will lay. And so we want as much stem as possible through this whole part of the quad. And so depending on the person, the pad might be higher. If we can get a little bit more of the quad, we'll put it a little bit down lower if somebody has a shorter leg. And there is a smaller version where we can take the electrodes and even shorten it down further for either a patient who is younger or has a smaller femur. I'm gonna lay this over top your leg if that's okay. And there are electrodes that come inside the box here. There are 4 different pieces to them. And there are 2 different sides. The side that has the conducting part has a big grid on it. They are pretty sticky, so I'll just let you see these 4 here first. And they fit just like a puzzle piece. And since his quad is a little bit on the longer side, we're gonna stick this up higher so that we can make sure we can get as much of the stimulation going to his quad as possible. And then we wanna make sure that this gridded part is face down and in contact with each of the pieces of metal. Just peel all of those off individually. Stick them on here. And this guy. And then this one. And once these pads are on there, they really don't have to come back off again until they become less sticky or they're not adhering very well to the skin. And then we're gonna peel each of these off individually. We wanna save these because we will end up putting them back on to protect the gel and make the pads last for longer. So we're just gonna set them off to the side. Once again, very sticky, not bad though. Peels all the way off. And then I like to take the Kneehab when we're putting it on to make sure that it lines up with the kneecap, because they are very sticky. Once you kind of have committed to a spot, you have to either take it off again to put it on, and the best way to make sure that you get it exactly where it needs to be is to set it right on top of the kneecap there, and then let it slowly kind of roll down the thigh. I always warn patients that it's pretty chilly the first time we put them on. I joke that I don't put it in the freezer. Most people are fine with that. And so we're gonna just tighten around the leg here. Perfect. And make sure that that feels comfortable. And I always kind of like to give it a little push down at the end. Make sure we have everything nice and ready to go. Comfortable?
Feels good.
Yeah, awesome. And then we're gonna get this controller out here. We're gonna walk you through how to use it. So this here is the charger for the device. It plugs into the wall. Obviously not plugged in right now, but when we go to connect it together, you just take the top of the piece that's attached to the charger. It has the gold pieces that are right there on top. And then we're gonna take the top of this device also. It has the little symbol on it, and we're gonna just slide them in and connect them to one another. You should hear a snap so you know that they're fit. And then if this were to be plugged into the wall, we'd see a little symbol, a battery symbol that would light up here on the front of the device. So now that it's on his leg, we're ready to attach the controller here to the device. And so what we're gonna do is make sure that we're gonna grab this Neurotech logo here, keep the symbol side up as we go to attach it in, and it'll just slide in there nice and easy. You'll feel a click. If you don't hold this piece down here, this can glide in and out pretty easily, and we don't ever want it to get stuck down inside the device. So a simple hand hold here, and then a little click in of the device. And then it is ready to be powered on. Now in order to turn on the device, we're just gonna hold this power button down on the left and hold it down for 3 seconds until we get a little beep. It'll wake up, which is great. And it'll show you the length of time on that screen, how full your battery is, and then that number up at the top, that number 1, is the program setting that we have right now. And you can change through any of the programs by holding down the P button. That's there, you hold it down for about 3 seconds, same thing, you'll see that number change at the top, and you can kind of click through. And there are about 9 programs on this device, and the first 6 are meant for strengthening after surgery, and then 7, 8, and 9 are for different types of pain management. And all of those parameters are inside the controller box with their frequencies and their pulse width and duration, and their contraction on-off rest time, which is good to know. And so typically speaking, we always start with program number 1 when I'm teaching a patient what the device is gonna feel like. And so we will let it stop right there. And then the up buttons and the down arrows are gonna control how much stimulation comes from either side of the device. And so go ahead and start hitting those buttons up. Sometimes we like to take one side up at a time, all the way until the patient feels like they get a good solid contraction. I mostly tell people that it feels like their leg is gonna fall asleep, or that they get that tingling sensation, and then it might become slightly uncomfortable, but that typically speaking, when we can get it up to the point where they are feeling a quad contraction, it becomes a lot more comfortable. So once you're done using the Kneehab, you disconnect the controller after you've turned it off. And then one of the easier ways to get the Kneehab off, obviously you have to take the Velcro off first. We're gonna straighten that leg back down. And then as you go and peel it off, sometimes it's nice to just hold the skin down because those pads are pretty sticky, and that just kind of helps with the comfort as you take off the device. I'm gonna lay it back over top of his leg, and you can notice that obviously these pads are pretty sticky, and they will pick up anything, including your own hair or leg hair or dog hair or cat hair of any kind. And so it's always a good idea to make sure that you are recovering these pads immediately after you're done using the device. We wanna make sure they stay as clean as possible so that you can keep using the same electrode pads for as long as possible as well. And then when you store it, you can fold it back up and it's ready to go. So this is weight shifting with the Kneehab, and we're gonna go side to side and front and back. So I'm gonna have you place your feet shoulder width apart. Excellent, and you can put your hands on your hips or keep them wherever they're comfortable. And I'm just gonna have you shift all of your weight as the Kneehab contracts over to that left knee. Great, and then when it releases, you can come back towards the right. And so what we're looking for here is for her, as she shifts over to the side, for that quad to fire, really contract, kind of maintain the stability of her knee when she's standing, and then come back. So oftentimes after surgery, patients are uncomfortable loading their new knee completely, and this can really make it feel a whole lot more comfortable for them. Excellent. Side to side tends to be easier than forward and back, but it's also possible for patients to pretend like they're stepping forward. So I'm gonna have you take that left knee, just kind of bring it forward a little bit. Weight goes through your heel, and just like you were walking, you shift your weight over top. Excellent. And then back again. Yeah, that looks good. And so as they come forward, they'll feel that muscle contraction. That quad will really kind of help protect their gait as they're walking. And then they shift backwards as it relaxes. That's good. One of the benefits to the Kneehab device is that it's portable, and so often I tell my patients that they can walk around their home or even walk around the community if they feel comfortable using their Kneehab device in their everyday life. And a lot of times they tell me that it gives them the sensation of more support as they're walking, especially in the first weeks of surgery. All right, so this is quad sets. I'm gonna take a little towel and put it underneath of her ankle. We're gonna let the leg just stay nice and straight, or as straight as she can tolerate. And what we're gonna have her do is activate her quad by kind of thinking about one of two things, either pushing down towards the table. I tell patients sometimes to think about bringing their kneecap towards their nose or towards their belly button, so we get that superior migration of the patella, and we see a good, solid quad contraction here. That's excellent. This is really important for patients who are getting up and moving around, especially right after surgery, and kind of fighting some of that inhibition of the muscle that happens because of the incision, and also just because of the arthritis that was present and the weakness that was present in the knee before surgery. All right, this is the quad set with the Kneehab. So I'm gonna take a towel roll, place it underneath his foot. We're gonna let it just relax here. We really want full knee extension as best as possible when he's doing this. And what I'm gonna have him do is just contract with the Kneehab as the stimulation comes. And you're just gonna go ahead and tighten. Excellent. He's gonna hold it for the length of the stimulation. That'll be different depending on the program that you use. And then it'll just stay nice and relaxed. I like the toe pulled back just a little bit as the stimulation is coming on to just get a full contraction. That's perfect. This is one of the best ways to start off getting the quad to fire after surgery. This exercise is the short arc quad. So I'm gonna take a bolster and place it underneath of her knee. Good, excellent. And then you can just let that relax. We're gonna ask her to contract her quad as her heel lifts up into the air. Hold it at the top, and then nice and slowly let it come back down. That looks great. Sometimes it's easier to bring the toe back towards your nose, so we get a little bit more quad activation here. Excellent. And I tell patients that we really want them to get this full control of all of their knee extension. That's a key part of them feeling like their leg won't give way or their knee won't give way when they're going up and down stairs, or when they're walking up an incline, or sometimes even when they're getting out of a chair and first taking that initial step. And that looks really good. This exercise is a short arc quad with the Kneehab. So we're gonna take a bolster, place it underneath of his knee. This leg is just gonna stay nice and relaxed here. And then what I'm gonna have him do is, as the stimulation comes with the Kneehab device, he's gonna lift his ankle up into the air, hold right there at the top for the length of the stimulation, and then when it relaxes, nice and slowly come back down. And I really find that this is a good exercise for patients who feel like their knee is unsteady when they're walking or maybe gives way. And so we really want to encourage them to be able to control all of this extension, that terminal knee extension, for their gait, and then back down. Sometimes if a patient is unable to lift that leg up all the way on their own, I'll kind of give them a little support up here, have them hold it and grab on, and then slowly lower back down. So they're doing a little more eccentric training, which oftentimes makes them feel like they have more quad control through that. That's good. This exercise is terminal knee extension with a band. And so what I'm gonna have her do is keep her feet shoulder width apart. Excellent. And then we're gonna let her unlock her left knee here. Good. And then straighten it back out of the way. And unlock a little bit. And then straighten. That's excellent. This exercise is really good for getting that terminal knee extension control, very important for gait, and that initial loading response that happens when someone takes a first step. This exercise is terminal knee extension with a band with the Kneehab on. And so what I'm gonna have him do is place his feet shoulder width apart, and there's a band wrapped around his knee. They're attached to a wall or a table, or someone can hold it. And what he's gonna do is unlock his left knee when the quad is relaxed and when the stimulation is relaxed. And then as the stimulation comes, he's gonna squeeze backwards. Think about acting that quad fully. Great. And then holding it, and then we're gonna let it relax. And it's gonna come back forward nice and slowly. Excellent. All right, this exercise is terminal knee extension in prone. And so I'm gonna have her take her toe, put it on the table. Excellent. And then she's gonna tighten her quad and try to straighten her leg as much as she can, and then come back down. This is a great exercise for patients who might not be able to activate their quad volitionally. And so there's not a lot of cheating that can be done. We don't get a lot of glute involvement or hamstring involvement doing this exercise. And so it's really very isolated to the quad. Very good way for them to get a little bit more control with that end last bit of extension as they're learning how to fully control their knee when it's straight. This exercise is prone terminal knee extension with the Kneehab device. So what I'm gonna have him do is place his foot on the table here. And at home, somebody can do this with their foot on the bed, or if they can get to the floor, that's appropriate too. And then what we're gonna do is when the stimulation comes from the Kneehab device, we're gonna have him contract his quad, lift the leg up into the air, and then nice and slowly come back down. Good. Some patients might get a little bit of back pain laying in this position, and so a pillow underneath of them is perfectly fine. And this is just a great way for them to really isolate what's happening at their quad. It's very difficult to substitute anything. And so we really just want them focusing on getting all of that end range extension control, very important for their gait cycle and just in making sure they have good stability at their knee. That looks great. This is the straight leg raise exercise. And so her knee is bent here so that we can prevent some back pain that might come along with both legs being straight. And what I'm gonna have her do is tighten her quad as much as she can here with that toe pulled back. That's excellent. And then she's gonna keep the leg perfectly straight. She lifts it up into the air. Good. And then back down nice and slowly. Excellent. And we want to make sure that patients doing this exercise don't have any extension lag, so they don't have any slight bend in the knee. We want to make sure that their leg is all the way straight and locked out, that this quad is activated as much as it can be, and then coming all the way back down. If they can't actively control that, they're not ready for this exercise yet, and they need to go back to learning how to control more of their terminal knee extension before I will let them progress on to doing this exercise, which is a little bit more complicated. But it's a good exercise for them to keep doing throughout their rehab and even throughout the life of their knee, to make sure that they are maintaining their quad strength as the knee continues to become incorporated into everything that they're doing in their daily life. This exercise is the straight leg raise with the Kneehab. And so what I'm gonna have him do is bend his right knee up. And that's really just to protect his spine so that he's not using lumbar extension to lift his leg or feeling like he gets any back pain during this exercise. We're gonna have him tighten the quad when the Kneehab contracts. We're gonna just squeeze really hard and bring that toe back towards you. And then he's gonna just lift that leg, keeping it perfectly straight all the way up into the air. Good. And then back down nice and slow. I like for patients mostly to go to the height of this knee, because anything past that, we really lose the lever arm and we lose the weight of the leg, and the exercise becomes a little bit less effective. Go ahead again for me. Perfect. And so I like patients to be able to demonstrate a perfectly straight leg, and as they come back down, to make sure the back of their knee and the back of their heel is hitting at the same time. And that just shows that they don't have an extension lag when they're moving. And if they don't have that lag, this exercise is perfect for them, but if they do, we really want to make sure that we're backing them down to something that's focusing more on their terminal knee extension control before they're ready for this one. This exercise is a step up, and so what I'm going to have her do is place her left foot up onto the step. Excellent. And then I encourage patients to put their weight through their heel as they're doing this to get their quad to fire. She's going to step all the way up and then back down nice and slowly. We want to make sure when patients are doing this that they're not using this leg to push up into the air, and that they're not using this leg to lower themselves all the way down. And that as they do this, the knee doesn't come too far forward over the toe, and that we're not seeing any valgus at the hip as they're doing that. So we want to make sure that that hip external rotators are firing as they step up and back down. Obviously a very functional exercise for most patients to do after surgery, as going up and down stairs is pretty common for most people to be able to want to accomplish. Okay, this is a step up with the Kneehab device. And so you're gonna take your left leg, stick it up on top of that step. Excellent. And then as the Kneehab contracts, she's gonna push her weight through her heel and then step up onto the step. Excellent. And then nice and slowly while it's still on, step back down. And then we'll rest while the Kneehab is taking its relaxation break. And obviously anytime in the clinic, an 8-inch step doesn't have to be the one that you use. You can use a smaller one. 2 inches is ideal kind of for patients starting to get the hang of really activating their quad as they go up a step and then learning how to unlock their knee without using their right leg to push them up or to support them as they come back down. And so they should be able to use that contraction from the quad to get their leg up onto the step and then slowly back down. I'm picky about knee position also when they do this. And so as you step up, we want to make sure that that knee's not coming too far over top of their toe and that their knee isn't experiencing any valgus at their hip. And so we want to make sure that they're activating their external rotators out here, pushing through your heel and stepping back up. Excellent. You can make it just slightly harder by having the patient step up, and as they step up, bring their knee into the air for a little extra bit of balance at the end, and then step all the way back down. Lots of variations to this. Good. This exercise is sit to stands, a very functional exercise for most people to perform after surgery, and especially once their strength is good. And so I'm gonna have her just separate her knees from one another so feet are about shoulder width apart. Good, hands can be on the hips or across the chest wherever they feel comfortable. And then she's gonna stand up with the weight through her heels, keeping her trunk nice and tall, and then nice and slowly coming back down. And I like to make sure most patients keep their knees separated from one another here so that you don't see any valgus at the knee coming from weakness at the hip. And we also like to make sure that they're not leaning too far forward where they're kind of getting out of using their quads by using their momentum to stand. So we really want to make sure that the weight is going through their surgical leg and they're not cheating in any of this exercise by shifting their weight over to the non-surgical leg. Sometimes you can take a little bolster or a block and put it underneath of the leg that they had surgery on to encourage more weight bearing through that leg too. And that'll help with the strengthening process also. Looks good. This exercise is the sit to stand with the Kneehab device. And so what I'm gonna have him do, patients can use their arms if they absolutely have to, but I like them to cross their arms over their chest or just keep them by their side if they're comfortable. And as the stimulation comes to the quad, they're gonna lean forward, stand up, nice and slowly. Perfect. And then even as the stimulation is coming, they can go ahead and sit back down nice and easily. Great. I like to make sure that patients' knees are kept apart during this exercise so that we're not getting any valgus at the hip. And I also really like to make sure that their knee isn't coming forward over top of their toe. Go ahead one more time. Excellent. And you can vary the height of the chair, so if patients have a hard time getting up or getting down out of a lower surface, you can add something to it, or we can use a higher table. They can do a mini version of this where they're just doing a slow attempt to sit down in the chair and stand back up. So there are many variabilities, but all of them are going to require them to use the Kneehab stimulation as they go to stand. Right, this exercise is ankle pumps. And so what we're gonna have him do is lay all the way down flat. So one of the things that's important for this exercise is we really want the leg and the knee to be either level or above his heart. And so I'm gonna have him bring his toes, and we're gonna do both legs back towards him and then point them down like he was pushing on a gas pedal. Perfect. And he's just gonna kind of repeat that process over and over again. And this is really to activate the muscle pump that's in the back of the calf. It's important for knee swelling after surgery, but it's also really important for prevention of deep vein thrombosis or blood clots that are common after surgery also. And so if patients feel comfortable doing it this way, they can. I sometimes tell them they can lay on a couch at home and prop their legs up onto the armrest, or if that isn't available, they just lift both their feet up in the air, prop a bunch of pillows underneath, and they can do these ankle pumps up and down. They can do it while they're icing. It's very easy to do. We encourage people to do it about 30 times every hour if that's possible. And a lot of times it feels good just to get the knee moving and to get the calf to fire a little bit too. That's good. This is called a bridge. And so you're gonna lay down on your back. Good. We're gonna bend both of your knees wherever they feel comfortable. And I like my patients to have their knees separated from one another so that they're not using their adductors to really fire when they're trying to move up in this bridge. Good. And I'm going to encourage her to put her weight through her heels as she lifts her hips up into the air. Good. And then back down nice and slowly. Some patients, depending on who they are, will have a little bit of back pain with this, and I encourage them to only lift as high as they can tolerate, just based on what their symptoms are in their spine. This is an exercise for their hamstrings and their glutes, so we want to make sure they're not feeling any pressure in their low back, and we also want to make sure that they're not overfiring what's happening at their quad. And so we're really just looking for hip strength with this exercise, and that's a lot of times why I encourage them to push through their heels instead of through their toes. That's great. This exercise is a clamshell, and so he's on his side, just nice and comfortable. Upper body can really do whatever it feels like. You can put a pillow underneath of their head if they need to relax their neck. And so he's gonna keep his hips really still. His knees are about 90 degrees just in general, and I like somewhere between 90 and 60 degrees of hip flexion here also. He's gonna keep his ankles together and then lift this top knee up towards the ceiling and then back down nice and slow. I find that this exercise is a hard one to get patients to understand if your hands aren't on them or your instructions aren't clear, and so a lot of times they'll cheat and try to rock their hip back to impress you and get this knee to go a little bit higher, but I really like the focus to be on the hip external rotators, make sure they have good pelvic stability, and that they're really firing from their posterior glute as they do this. That looks good. This is a side hip abduction exercise. It's a progression from the clamshell when patients can tolerate those pretty well. So I'm gonna have her just straighten her top leg. Her upper body's gonna stay nice and relaxed. Some patients feel like they'll fall over when they do this, so I encourage them to kind of grab onto the edge of the table. And then we're gonna take her leg into a little bit of hip extension because that's where glute med fires the best. I'm gonna have her hold it here. This is kind of where I like to start. And then she's gonna slowly lower her leg down towards the table and then pick it back up nice and gently. And so I'm gonna really make sure she's not over-exaggerating this motion, trying to get her leg a lot higher or let it drop too far down towards the table. We really want isolation of her glute med while she's doing this. Looks good. Great. This exercise is prone hip extension. And so what I'm gonna have him do is just lift his leg, keeping it all the way straight, up into the air and back down. Very simple exercise. We're just targeting the glute and a little bit of the hamstring here. I like to make sure patients keep their leg as straight as they can, so we're getting the glute to really fire. And if we feel like they are getting any back extension, lumbar extension with any of this, sometimes I put a pillow underneath of them so that they feel like they can relax through their lower spine a little more. And then we're gonna have him just keep repeating that to strengthen all his posterior chain. So this is a standing hamstring curl, and patients can hold onto a counter if they want, or if they're comfortable enough with their balance to be able to stand. What she's gonna do is keep her knees about level. She's just gonna bring her heel up towards her back, good. And then back down nice and slowly. We really just wanna get that hamstring in the back of her leg to activate a little bit. It's good for knee flexion, and it's good just to kind of build some basic strength for walking and for swinging that leg through during the gait cycle. This exercise is sidestepping, and so it's important for hip abductors to be able to feel stable moving laterally. And so what I'm gonna have him do is just very slowly, while he's keeping his hips level and shoulders level, he's gonna take some steps to the side. Good, and I like patients to start off with no resistance to make sure their movement pattern is good. And then once they get to the point where they can demonstrate that well, I'll take a TheraBand, whatever color or strength you feel is appropriate, and tie it around the bottom of their legs. You can put it at their ankles or at their knees, depending on how much resistance you want, and I'll have them perform the same exercise with a little bit of resistance. This exercise is a standing heel raise, and all I'm gonna have her do is keep both feet on the ground. She's gonna lift her heels up into the air and then come back down nice and slowly. Good. And so you can encourage patients to put a little bit more weight into one foot or the other based on which leg you wanna focus on strengthening. And when they become strong enough to do this on one leg, you can have them hold onto a counter for their balance. They can lift the other leg up into the air and then work on just isolated strength of the surgical leg.
We've been extremely happy with this rehab program, and more importantly, our patients have been very happy with this program. I think adding a neuromuscular stimulation to our program has really brought it to the next level. Patients have reported things such as decreased postoperative pain when they've used the Kneehab device. We've seen earlier quadricep function, and we've seen improved quadricep strength. Studies utilizing the Kneehab device in ACL reconstructions have shown improved quadricep activation, improved quadricep strength, and earlier return to work. We're currently evaluating the Kneehab device in total knee arthroplasty patients, and we are seeing and expecting similar results to the ACL reconstruction studies.